Good evening once again. I don't know if that side is already evening or it's still afternoon, but the greeting can still work. So today we are going to interest ourselves in data collection and some bits of data analysis, which are very important aspects of our M&E practice. And since we are focusing on M&E in nutrition programs, we are going to see a way of relating what we are learning to that. Sorry, might be seeing some other things, but with time they are going to go away, and then we can go on with our presentation, and they have gone right there. So last time when we met, which was I think on Wednesday, we looked at how programs are really structured. We looked at how programs flow, from the word go, where we have activities, they link up to outputs, and those outputs link to to the outcomes, and then the outcomes link to the impact. So we saw that flow, and we were really able to appreciate that a program does not just achieve its set objectives out of nowhere, but it starts with those uh, few objectives, and then from the objectives you build your activities, which will lead you to the final goal which you want to achieve. So we were able to look at those aspects of the program, and then uh, so also how to do evaluation. We hinted on how to do evaluation, and today we want to know how we can collect the data that will help us, first of all, in the monitoring and then evaluation of whether our program has been successful or not. But also remember that before we do anything, before we implement any program, we need to collect data, which will form what we call a baseline. I think there is someone who hasn't muted their microphone. Okay, so we can go on. So I was still trying to say that the importance of collecting data is that it helps us in making sure that we analyze whether we have what we wanted to achieve or not. But also it helps us to know, even before we implement our program, where the community or the target population stands. Okay, so if you want to implement your a nutrition program, and maybe you're focusing on reducing stunting, you want to know where stunting is. Okay, is it in 80% of the children? So that could be like your baseline. So this is why you need the data collection here. So you collect data, and then what your program is going to be focused at achieving. Because if stunting is at 80%, maybe you can say our program will reduce it by 20%, meaning it will go from 80 to 60. But you can not do that if you do not have data, if you do not have information which is collected using these data collection methods that you are going to see. So data can be both qualitative and quantitative, and we are going to see the difference. So qualitative is just that data which is non-numeric, or it is not in terms of numbers or figures, and it is just descriptive in nature. So you look at things like images, audio recordings, text. You know, basically, we look at that data which cannot be really quantified easily. Okay, so if you're going to ask someone to give their opinion, of course that cannot be put in numbers. It is really qualitative. So that is a text. Then an image is also, it can tell a story about something, but it cannot be put now into numbers. So that is why we call it qualitative data. you know so it is very important, especially when you're assessing for attitudes, practices, knowledge, of a group of people or your target population on something. Okay, so if you want to know whether people are going to to if people are willing to take on your nutritious food, or they have a better attitude towards eating a nutritious food, then you can ask using those qualitative kind of methods of data collection. Then when we talk about quantitative, this is the one which is numeric. So it can be quantified. It is you can assign this data numbers, you can put percentages, yeah, such things like age, height, weight. So those things are very quantitative in nature, and you can always use quantitative data collection methods, which we are going to see as we go on. So to go on and talk about quantitative data, it can be uh, dichotomous in a way that it has two options. You can say maybe people who are malnourished and those who are not malnourished without having any other option. Then continuous, for example, height, you have a lot of a lot of a lot of heights of people. If we are to go in maybe our class and see the weight, you will see a lot of variations. One could be having 180, another one 181, 182. So it is not dichotomous in nature. And then categorical, which can be either nominal or ordinal. So the nominal one is also more of the other one of dichotomous, which is more of having two uh, two options. For example, in gender, you're going to expect male or female. Then ordinal can take on a lot of categories, like and there maybe if you're asking to assess for a practice, then you will be asking questions which you are going to see later when we design a questionnaire, and you'll be seeing questions of strongly agree, agree, disagree, and then strongly disagree. And these questions are always attached with numbers, so that we can make them quantitative in nature. So when you you ask a question and you want to assess for perhaps knowledge about uh, nutritious food. So if you want, you can pose a question, for example, like, do you believe uh, babies or children under 5 years require iron in their food? So you put those answers of strongly agree, agree, disagree, disagree, and then strongly disagree. So you gauge if someone says strongly agree and you have put it, you have given it a numerical attachment of 4. That means that the person who answers with strongly agree has more knowledge about the nutrients that are needed for the growth of a child or a baby, okay? Because they have strongly agreed to that question. Then as you go down, the knowledge reduces. So it brings out that quantitativeness of that data, okay? And then so this table is just explaining what is in this slide, to majorly explain more about what we find in nominal, which I had told you about, and then ordinal, where you can have such questions like we have just discussed. Then in continuous data, you can have that which is talking about things like we have looked at here, the height, the weight, and other things that you are going to see here. So the table is not so clear here, but it is very important to better understand what we are looking at in quantitative data. And then if you're to differentiate them, because now someone might be wondering, yes, these approaches of collecting data are all important, but which one is better or which one can I take on? So the best practice, especially when you're starting or you are starting out, is to combine the two. You have a mixed kind of methodology where you have some aspect of qualitative and then some aspect of quantitative, okay? So that you can have more power of your research, as you are going to see with time. So in qualitative, uh, it is more structured, or you have questions which have already been preset, those that you are going to ask, and they cannot be changed when you reach into the field, okay? So if you want to ask about the knowledge of those people concerning the need for iron supplementation amongst their children, then you ask that question which I posed earlier, that do you think iron supplementation is important in the growth of a child? Then you put those strongly agree, agree, disagree, and strongly disagree. So that is in quantitative. It is already preset and you cannot change it. But now, when you look at qualitative, if you wanted to ask about iron supplementation, you would ask the question in a way that allows the respondent or the person that you're targeting to give you information so that they can give you more information or they can go deeper. So there you are not going to ask them and use the answers that you already have, but you can ask, in your opinion, do you think iron supplementation is important? So they will now tell you a lot of, they will give you a lot of stories here and there, but you have to capture that. In fact, in qualitative data collection, we are advised to even have recorders. If you have a recording device or your phone can record, you use it so that you capture each and everything, because it will be important in analysis. So we realize that in quantitative, it is structured and there is no room for changing. But in quantitative, you can always change. Then when you look at emphasizing reliability, and then this one emphasizes validity. So just majorly looking at how they make the research study have a better power, or it can be generalized on the target population. Okay, so we also realize that in quantitative it is harder to develop, but qualitative is easier because of course now qualitative does not need a lot of those sophisticated questions to set. You can just even set some questions when you reach in the field as per what you need. Then, but on the other hand, when it comes to analysis, quantitative is easier to analyze, as you are going to see with time, but qualitative is harder to analyze because it involves a lot of themes and sub themes which you have to bring here and there so that you can analyze correctly. Then, so basically, you realize that these approaches, qualitative and quantitative, are needed in different settings. In quantitative can take on when you want to generalize to the entire target population, and then in qualitative, when you want some in-depth information, when you want to go deeper. But if you want some simple information about perhaps the stunting level of the community, you can just get it through quantitative methods, where you assess, you give them some interviews, and then you design your analysis protocol, and then you analyze faster, and then you can get your results. But in quantitative, if you wanted to know the reasons why there is stunting, then now you have to use qualitative, because for it will go deeper. And then the tools, so we are rushing through this because the slides are a bit many, but when you get the notes, you should be able to see other clear-cut differences, and maybe what you don't understand, you can always reach out to me and we explain. Then when we talk about the tools that are used in quantitative, we can use surveys, interviews, observations, while in qualitative, there you have to use in-depth interviews now. They shouldn't be just uh, they shouldn't be superficial interviews where you just ask a few questions and go, but they should be in-depth. You can have focus group discussions, as we are going to see. You can have case studies, surveys also come in here, and then observations. Then the sample in a quantitative approach, because you are going to collect, you are going to use you are going to you are not going deeper, so you need a larger sample in a quantitative setting. But in a qualitative, because you are asking one person a lot of things, so there you will need a smaller sample to represent the target population. Then the output, what do you expect after you've collected the data? In qualitative, you expect, of course, numbers and that numeric data. But in quantitative and in qualitative, you expect words, text, pictures, audios. Then, so that is basically it. And even the analysis is a bit different, as we are going to see. So when you're considering which data collection method to use, you need to have in mind what uh, software you are having to analyze this data, because there are a lot of different softwares to, first of all, to enter the data, and then to clean it, and then analyze. So after you've collected data from the field, for example, if you wanted to know the nutrition status of people of women in a given region in South Sudan, so you would want to collect this data from the target population. Of course, you do sampling, and we are going to look at how you can sample in the next session. But now, after collecting the data, there are always some few mistakes here and there. Maybe you forgot to ask a question and now it is blank, so you cannot go back to the field. There is always a way to eliminate such an error, and then that is what we are calling cleaning. So after you've collected the data, you clean it, and then you can do what we call coding, so that you attach uh, the texts to numbers. So if someone told you that they are married, there could be a number that you can attach married to that person who is married to a number, so that this software package can be able to analyze very easily, because these softwares deal with numbers. So if you put in uh, married as 1, then single as 2, maybe divorced as 3, it will be able to understand this easily. So after collecting, you clean, then you code like the one I'm saying, and then after that you can do analysis. So these softwares are designed to help you do all that. They can help you to enter the data, to clean it, to analyze it, and make sometimes reports. Okay. So you also need in your project, maybe you can think about hiring a statistician, and these people always are very good with numbers. So if you do not have the right expertise to collect to analyze this data, you can always hire statisticians so that they can handle that data and analyze it very quickly. Then you also need to think about where you are going to store and how you are going to store this data, so that it cannot be compromised or hacked into and maybe taken for malicious issues. So all these are the considerations that you need to look at, okay? Before you even do the data collection, you need to know the software you're going to use, whether you need to hire a statistician or not, and the data security. Okay, so you need to make a plan before you even do the data collection itself. So sources of data, like we had said in the first or the inaugural session of M&E in nutrition programs, we said we can collect data by going into the population, okay? If you have done your sampling, as we are going to see in the next session, you have targeted 1,000, a population of 1,000, but of course, due to resources, the time, you cannot reach all those 1,000. So you have sampled out of those 1,000 to get only 100 as your sample. So you can go to those people and collect the data from them, which will now be primary data. But also you can use secondary data. This is data that is already there, okay? So you can either go to reports, either on the internet, you can use government surveys. For example, governments always, especially in the health sector, always publish those surveys, especially the demographic health survey, which tells you about perhaps people living with HIV, people sleeping under mosquito nets, people on antiretroviral therapy, the people who are having severe acute malnutrition, or what we call SAM. So you can review that data to give you what you want. For example, if you want uh, a baseline number, and you do not have the resources to go into the community or the target population to collect the data, you can always use this secondary data sources to get that information. So that is how different it is. So the primary, you go into the population itself, you face them, and you use key informant interviews, surveys, focus group discussions, and observations. And we are going to look at this as we go on in this session. Then in the secondary, you do not have to go there, but you can utilize the information that is already there from the donors, from other partners, from the government surveys or reports on the internet, and you get your data. So that is where we are. And now we go into the gist of the matter. How can we now collect data after knowing uh, all these, after knowing the importance and how different qualitative and quantitative are? We now need to know the exact collection methods. So in qualitative, if you're collecting text, audio, video, images, that qualitative data which might not be given number, which we are calling qualitative data, you can use focus group discussions, you can use individual interviews or key informant interview. So it can be a key informant interview whereby you're going to ask questions an individual who is thought to know more about a topic. Okay, so if I'm looking at nutrition, for example, and I go to a certain community, I need now to look for those people like nutritionists in that area. You can look at health inspectors who have been dealing with these organizations that bring in nutrition programs. So those people are well versed with this information, and they are called key informants. So when you do an interview with them, it becomes a key informant interview. So those individual interviews can either include an interview with a key informant, which will be a key informant interview, or it can be what we call an in-depth interview. There you do not have to focus on the person who knows a lot about a certain topic, but you can interview a person, just a normal person from the community, but you go deeper now, okay? To now be called an in-depth interview. Then document review is basically using those available documents, like I said. If they are there already, you can always review them and you get what you want, but now it will be qualitative in nature. Case review is just following up on the, for example, a group of people who have certain characteristics, or only one person, and then you really collect that in-depth data, because here we are looking at qualitative data which should be in-depth and should be rich. Okay, so the other when we look at quantitative, here we are going to use surveys. We are going to also use interviews, but now these ones will not be in depth, and then observations. Okay, so let's look at each of them in detail. Okay, so when we look at surveys, these are the most common. Okay, so I'm always going to be hinting on how to relate this with what we are studying. We are looking at nutrition programs, okay, and we are looking at how we can marry monitoring and evaluation with nutrition programs. These nutrition programs cannot go on smoothly without monitoring and evaluation. And one of the best ways to do your monitoring and evaluation is to conduct data collection and analysis. Okay, so you cannot monitor what you are not measuring. Okay, so, and you cannot measure without data collection. So that is why we need these data collection methods. Okay, so one of them, and the most commonest, is the survey. So this one provides you that targeted information about a sample from a larger population, and it is ideal for gathering data about perceptions, opinions, and ideas. Okay, so you have sampled the people that you want. Like I said, if you have the target population of people maybe in the south of South Sudan, or in a town in South Sudan, and they are 1,000. Now you've made a sample of 100,000 through the sampling methods that we are going to see. Then now you can ask these people by administering them survey tools like a questionnaire. So you ask them about perceptions, opinions, and then ideas about better nutrition, about stunting. What perception do they have? Do they think it is a disease that can be treated? Do they think that it is something to do with the gods? So they should be able to provide you this information very fast through this survey. Okay, because as you bring your program, it should be able to be welcomed by these people onto who you are bringing the program. So you need to first unearth how they feel, you know, about the problems that they are facing. Okay, so you do this through such surveys. So the purpose and limitations of surveys is that they can measure intended behavior but involve interpretation. Then data that is collected, one of the challenges is that it might not align with the actual behavior, because remember, you are collecting it uh, as a snapshot. You're collecting it and going, at that particular time. Okay, so it might not align with actual behavior of a person. So, for example, if I came and I wanted to assess whether people in an area X in South Sudan eat 3 meals in a day, which maybe is a standard. So I can ask as a question of that survey, did you take 3 meals yesterday? Okay. So that question, if a person was maybe paid well uh, yesterday, and they are working in a way that they are paid on a daily basis. So if they worked and got money and they ate 3 meals, it does not guarantee that even the next day they will get those 3 meals. Okay, so they might answer that question and say yes, and I take it as if they are feeding well or receiving all the meals, but in actual sense, it doesn't depict the actual behavior or the actual situation of those people. Okay, because now if someone ate 3 meals yesterday but goes on to miss the 3 meals for the next 5 days, then there is a problem. Okay, but your survey will not capture that. Okay, then it is also vital to use random sampling for representative results. We are going to look at how to do random sampling in the next session. So the types of surveys include cross-sectional survey, which is what I was talking about, that where you do a snapshot, you come maybe before you implement your nutrition program, and now you ask, like that baseline survey, you ask people how they are doing by administering those questions. Okay, do you eat 3 meals in a day? Which food are you taking? And then when they answer, you collect that data, and then it is just a single point in time. Okay, but when the improved survey would be a longitudinal survey whereby you are going to track these people over a time. Okay, so you're going to start perhaps in this month, and you follow them up for around 5 years to see. Maybe you could have introduced your intervention of nutrition, and now you want to track and see if there was an improvement. Okay, so that is what we call a longitudinal survey. The problem with this longitudinal survey is that, yes, it is good, but it takes time. And of course, when it takes time, it requires a lot of resources, both human resources and financial resources. So it can be a bit tedious. Okay, but it would be the best to portray that real relationship. But most times, people tend to use this cross-sectional survey, and the limitation I showed you in the previous slide. Then, apart from surveys, we can have interviews. And the objective of these interviews, especially when they are in-depth interviews, they are to gather in-depth information, understand perceptions, experiences, and context. Then they also explore those complexities and nuances. And these nuances are just like those subtle differences, those differences in in the population that can be ignored. Okay, so when you do an interview and it is in depth, then it is able to unearth such complexities and those differences that you would not have noted if you did that cross-sectional study or survey. Then to complement other data collection methods, so you can have these in-depth interviews in addition to your survey. So as a researcher or as an M&E specialist who is going to implement these nutritional surveys, these nutritional programs, you need to be very flexible. You need to implement those methods that will work for the best of your organization. Okay, so if you're called on to be a monitoring and evaluation assistant or officer in an organization X that is implementing a nutritional program, you do not need to be fixed and say that from I'm going to use a survey only, but you can always have a mixture of these methods so that you can collect data that is very rich and gives your monitoring or evaluation a lot of power and a lot of sense, and it can be generalized on the other target population. Okay, because you don't need to get information that cannot really be generalized to the entire population. You cannot say that there is stunting because of a few people that you interviewed, and yet when you go into the community, there isn't a lot of stunting. Okay, so that is what we are calling that generalization. So interviews are good in those areas. And then the types include structured, semi-structured, and then unstructured. Structured, like we had said, you have those questions which are already predetermined and you can't change a lot. Semi-structured can have a mixture of two. You have those which are already predetermined, and then you can also always have room for elaboration and write what someone feels like they should tell you. And in unstructured, of course, these are open-ended. You ask about opinions really here. So someone will be able to give you a lot of information, and it will help you to gain a lot of insight in the in what you're studying about. So we plan and prepare for these interviews by looking at our research objectives so that our questions align with these objectives and questions, okay? So you cannot be having questions about stunting and now you in your interviews you're asking about smoking, okay? Yeah, it should be always aligning with the research objectives and questions. And then, of course, because you are going to look to this target community, then you need to identify the people that you are going to interview, including the key informants, especially if you are going to do that key informant interview. Then you also need to develop a guide, uh, so that when you are doing interviews, at least you do not you do not you are not you are not disorganized, because if you have this guide, it is able to show you the questions that you need to ask. Yes, you might need in-depth information, but at least you should have a guide, okay, to show you what you need, the information that you need, even if it is given in depth, but at least you have where to place it. Then, after you've done that, you can now schedule the interviews, and they should be scheduled in a way that is convenient for the respondents, okay? So the respondents are given priority here, okay? You shouldn't schedule an interview in a place, for example, which is very open, and maybe people are going to look at you interviewing someone, and that can be an issue of privacy. And of course, as we shall look at that later, it is against the ethics of research. And then it shouldn't be on a day maybe when the person is very busy, so you should be able to communicate easily by building good rapport or a good relationship with this person when you talk, either on phone or when you're seeing them, and then they give you a time when they are that is convenient for them, and then you arrange logistics like transport and what you need to do the interview. So when you reach there, like I said, you introduce yourself and create that rapport. Someone should feel free to talk to you. Then you ask questions and listen very actively. So when you're listening in an interview, especially if it is in-depth interview or a key format interview, then you do not need to interrupt unnecessarily, okay? Of course, sometimes they can tend to go away from what you are asking them, but you do not need to interrupt unnecessarily and sometimes lose out on key information, okay? But of course, it doesn't also harm you to bring them back to the topic, especially when they go very astray. Then probing for deeper insights is more of making them go deeper on something that you need to know about, okay? So if you're asking about the for example the nutrition status of the community, and then you ask, in your opinion, how are people how are people in terms of nutrition in this community? So the person tells you they are good. So if they tell you they are good, it is not deep enough. So you probe, you ask for more. You say, they are good, but in which way? It's more of probing. And then they tell you they are good because I can see them not suffering diseases. So now you go even deeper and ask, which diseases do you think they could have suffered if they were not good? Okay. So you keep probing for deeper insights. It's what we are talking. And as you do that, take notes. You can record that audio, of course, with permission. You do not just record someone's voice without asking for permission. In fact, when you're introducing yourself and you give them somewhere to write or sign and say that we are going to give this person information, they haven't forced me, and I can read and understand what is entailed on this consent paper, and then they sign and allow you to do that interview and also record. Then managing time is very essential there, because an interview, especially which is in depth, can take long if you do not manage time very well. Because this is more of like storytelling. Someone will take you here, take you. So you need also be a bit a good time manager, so that you can always focus them on what you want, and then but as you do that, do not limit them. Okay, manage time effectively. So for you to make sure that you collect data of good quality, you need to make sure that those questions that you have are standardized, or they align with the research objectives and questions. And then there should be probing, like I said, reflexivity and interviewer bias awareness is more of being aware of yourself. You who is doing this interview should be aware of yourself, and you shouldn't let your perceptions override the other person's perception, and yet it is that person's perceptions that you need to get. Okay, so you need to be aware of what how you feel. For example, if you thought that there is malnutrition in a community and this person is telling you different, you do not have to rubbish them and push their opinion away. Okay, be aware of that, of your perception, but make sure that you go on with this interview and welcome their perception very well. Do not just push it away, because it is their perception that you are looking out for. Okay, then qualitative data analysis, of course, follows after that interview, and we are going to see later how we do this. Then the challenges, of course, bias and subjectivity, because you are getting information from someone and it is on this person that you are relying on to get everything from. So there can be that bias and subjectivity. So if you ask them about, for example, if the if this if if they feel that your nutrition program is needed in their community, they can say no, maybe because they feel like the past programs have not been doing well. Okay, so that bias and subjectivity, perhaps they also participated in that past program, and they were not compensated well, or they were not given money that they needed. So it becomes a challenge. Okay, then respondent bias and social desirability. Sometimes, especially in this social desirability, you look at the fact that sometimes these respondents answer in a way that they want to please you, or please the people that are around, or that they stay with. So if you ask that, if are you are you able to obtain the 3 meals in a day, they can answer yes, just because they want you to feel that they are doing well. Okay, or they do not want to feel like they are poor in the general society. Okay, so that can be a challenge, and yet you need to collect that raw data in its rawness. Okay, if they are not doing well, you would want them to say yes, no, I do not take those 3 meals in a day. Then limited generalizability is also a challenge because you are not interviewing a lot of people, and then if there is this bias, now you cannot generalize on the target population. If someone tells you that they are taking the 3 meals and it's just because they want to please you to make them look like they are doing well, uh, it will not be generalized properly to the target population. You could have noted maybe from the survey, from these from the from the key informant interviews or these other surveys where you use the questionnaires and do not interview face to face, you could have noted that there is indeed malnutrition, but this person is telling you that they are doing well. So there is that limited generalizability. So that was interviews, and then we need to look at FGDs, which are focus group discussions. So we are going to be a bit faster because our time is running out, and there are still a lot of slides, but you will bear with me. I'll try as much as possible to explain the key elements. I hope you're still getting me. Are you there? Anyone to say yes?
Yes, yes, we are getting you, sir. We are listening.
All right, thank you. You know the problem with these online sessions, it can be sometimes more of a one-man show, which is not so nice, but we shall see a way of accommodating the other participants as well. So that was interviews, and you saw their strength in bringing in that in-depth data that we might need, and their limitation in terms of bias. And now when we look at focus group discussions, you like the names, I guess you're going to put this target population or the sample that you are going to focus on into groups. Okay, so you can now group them into men and then women. Okay, but ideally you need a group of 8 to 10 or sometimes 10 to 12 people. Okay, so the maximum should really be like 12. They shouldn't be a lot because they are going to be hard to control. So you set these groups, and then because in research or data collection we do not use identifiers or the information that can be used to identify the person who said something, then you are going to attach numbers to these people. So you can maybe say uh, if they are women, you say W1, W2 until 12. Okay, then the men M1, M2, M3, up to 12. But the essence of these focus group discussions is to really get information variability. How do men's perspectives about uh, eating a certain nutritious food differ from the women's perspective? Okay, how do young men, or how do the young or the youth perceive nutritious food vis-a-vis those people who are old? Okay, so you group them into those different groups, and then you can listen to them. That there is that discussion which should be free flowing, but in that discussion you need to make sure that you're a facilitator. You do not just ask questions uh, and then you provide information to them. No, you just give a question or a guiding question, and then these people are going to be discussing, but of course one at a time. Okay, so you make sure that first of all you arrange the sitting venue, have the participants sit in a circle, explain the purpose of your research or your evaluation. Then you seek informed consent by telling them what the purpose of this research is, how their identifiers are not going to be put out there. No name will be given to anyone. How the data is going to be uh, important in making decisions that will be helping them. Okay, if there is compensation for their time, you also tell it to them that we are going to give you this money for your time that we have spent, and then you assign a note taker, because as you facilitate this group, as you guide on how people are going to participate in this focus group discussion, you need someone to be taking notes. You need someone to take notes, and then if they cannot capture everything, they can also do recording, okay, of that focus group discussion. So after you've done that, you make the recorders and logistics available, you start the discussion, use clear language which can be understood by the people who are taking that in taking part in that focus group discussion. Also probe, of course, here, because this is a qualitative data collection method. So if you ask about the nutrition status and the woman one has told you that it is good, you need to probe more and say, how good is it, Now, if that woman one has said it is good, you ask woman two, how good is it, And you should always encourage everyone to participate. Let no one make it their own show. So encourage everyone, even those people uh, who are not good at talking, encourage them and emphasize that they need to take part in this focus group discussion. Then, of course, after that, you end the interview, and then you can use that for analysis. So the advantage is that they provide rich data because they're in-depth. They are source of quotes, as we are going to see in when it comes to reports. You can always use what the people said in that focus group as a quote in your report, and it will be able to enhance your report and provide information that could not have been gathered through other methods. Then it provides an opportunity to understand, of course, a phenomena better, because it is generally in-depth, okay? You're asking a lot of people and in-depth questions. Disadvantages, of course, since it is in-depth, then it is time-consuming, and it results in huge data, which can be hard and time-consuming to transcribe. So you record these people, but you remember there are many. They are saying a lot of things. So for you now to write whatever they have said, it can be very tedious, okay? Yeah, and yet you have to capture it. So for you to be a good facilitator, you need not to dominate. Just facilitate. Do not be the one who is now giving the information, okay? Do not put people's ideas down or what, but just do not dominate, but just be a moderator. Encourage people who are speaking less to speak also, and you can also take notes as a good FGD facilitator. So we are being trained to really be good focus group discussion facilitators. Like I said, it is generally used to unearth the variability of all the differences in ideas, okay, between different groups of a population. So if you have women, if you have men, they might have different perceptions or ideas on a certain issue in nutrition, okay. For example, if you want to ask like about exclusive breastfeeding for the first 6 months, which is very essential in the nutrition status of a young child. So you might find from the group of men, for them they believe it is not so important, but from the women it is important, and they can always give you their insights from that discussion. So that is how important it is. Like I said, needs to not to be very big, but a maximum of 12, 8, 12. You shouldn't also have just two and you think that is a group. 8 to 12 is good enough, and then you can do your discussion. So that is the focus group discussion. And now we look at observation. So as the name suggests, it's more of watching and recording events, behavior, how people do things. So if I wanted to know how health workers use, for example, these weighing scales to measure the weight of people, I could utilize this data collection methods of this data collection method of observation. Go to a healthcare center of the population that I'm targeting and observe, and observe how these health workers are doing it. Okay. So the types of observation is, you can either be part of that setting where it is observed, where the observation is taking place. So if I wanted to observe how this weighing of people is taking place, I can go there myself and they weigh me, okay? And I see if it is done in a good way. Do they ask for permission before they even touch the patient, the patient themselves, or these people who are coming to the hospital? Do they explain to them what is going to take place when they stand on that weighing scale? So all that can be done, can be really appreciated if I'm a participant observer. I take part in that, in what I want to observe, okay? Then non-participant is where you observe, of course, from a distance, or you do not participate, okay? You are just an external unbiased observer. So you look at those people from afar or near, but you do not participate. So the purposes could be to provide direct and unfiltered data. It could be to validate or supplement other data sources. So you could have done a survey, but now you want to also unearth more information or get more information, and now you supplement that by using observation. Can be used to capture behavior and those non-verbal cues. So if you wanted to know how these health workers behave towards patients, there are some things that you might not get from surveys, okay? There are some things that the patients might not really tell you when you are interviewing them, okay? Even if it is in-depth interview. But you can see from the way people react, to some things. Those non-verbal cues, you're able to observe them if you use that data collection method. And then monitoring ongoing activities and progress, generating hypotheses for further investigation. So hypotheses, these are basically like theories, which you can put in place. For example, if we are implementing a program of nutrition about reducing stunting in the south of South Sudan, I can set an hypothesis or a theory and say there is no stunting in South Sudan, okay? In the south of South Sudan. So through observation, one of the data collection methods, I will be able to generate an alternative hypothesis and say that no, there is stunting. And then this will help us to use other data collection methods and analysis for us to answer or to nullify or really test these hypotheses if they are true or not. Is there really stunting or it is not there? So observation is a very critical method in terms of generating hypotheses and for further investigation. So before you even go before you even start implementing your program, you can observe some things, through those observations in health settings, you can see the behavior of these health workers. So you can set an hypothesis and say uh, the health workers have poor attitudes at work. Okay, so that is an hypothesis. So then you're able to lay ground for further investigation. Is it true, or you just observed it and it was just for it was just a one day thing, and it is not a pattern or something that they always do. So that is the importance of observation. So how we do this? Again, you make sure that whatever you're going to do or your guide should be aligned with the objectives and the research questions. You should be able to identify where you're going to do this observation from. Is it in the community? Is it the healthcare center? Where is it? Okay. Then you develop an observation protocol or checklist. Just show which things you really need to focus on. You're not going to observe everything. There are some things that you want to really focus on according to the objectives of the research, and that is what you need to use and develop this checklist. Then sometimes you might not do this alone, so you need to train observers so that they can always be accurate in observation in this observation. Okay, so when you have now done all the training and you're set, you start your observation. But during observation, you need not to be subjective. What you think is supposed to happen is what you are going to, and that is what you record. No, you should be objective and avoid any interference. So if you expected those health workers to behave in a rude way and now they are behaving well, you shouldn't capture the other rude expectation and say they behaved in a rude way. No, be objective and be sure to capture what you have really observed. Okay, then you should be able to record something that is detailed, because this one is also a source of good qualitative data, and there we said we need in-depth data. Then of course, do not just do it without a checklist, like I said, where you're able to, that is able to show, that is able to align you with your research objectives and helps you to achieve the goals of your research. Then you be mindful of course, the ethical issues. For example, if I'm going to observe these health workers, how the ones who are dealing with people with nutrition problems, I cannot just start observing them without seeking their consent. Of course, there is a problem of the fact that if I seek their consent, now they might adjust the behavior, but that is the protocol of research. Okay, you need to inform them, and they should be aware that you are going to be observing their activities. Okay, it is it there are some observational researches which might not uh, need this informed consent, but most of them will need you to really inform them why you are going to do it, how you are going to do it, and what are the benefits and what are the risks that observation poses to them. Okay, but in cases, for example, if you are going to observe types of cars that go over a street, and you wanted to know maybe how many cars are SUVs, how many cars are Toyotas. So there you do not need that informed consent. Really, it is a public place, and you can do your observation without any informed consent. But in other cases, you need to take care of that ethical consideration. So when you're done with your observation, you analyze the data systematically, and You look for those patterns, trends, and those deviations from the normal, and you compare observations with predefined criteria. Like we said, sometimes you can read from these document reviews or from past researches that there is some trend. So through your observation, you can observe another trend. So you do that comparison. It's what we are talking about here. Then you interpret the findings in the context of the research objectives. So like we said, as you collect data, you should be able to make sure that everything is aligned with your research objectives so that interpretation and analysis of this of what you have collected will be easy and it will be relevant to answering your research questions. Advantages of observation is that you collect rich information, you collect it in real time. Uh, you do not have to rely on people telling you, because in surveys or in those interviews, you're relying on someone's story. Okay, so if you ask someone who is going to a hospital that how do these health workers treat you, and they tell you they treat us well, so you can now in observation, the advantage is that when you go there, you're able to see it yourself. Are they being treated very well or not? Okay. Then high data reliability and validity, uh, because of course you have collected it yourself. You have collected rich information, then it can be reliable and valid. So you can use it sometimes to generalize to the greater or the bigger population. Challenges is that it needs a lot of resources, especially if you are not going to do it alone. You have to hire and train other observers, and then it can also be limited by observer bias. Okay, like we talked about earlier. Then, of course, here you are looking at just observable behaviors, but there are some things that may not be captured using only observation. Okay, so if you are going to use observation alone, there are some, if there is some information that you are not going to capture. But of course, like we said, it should be, you should be able to design your data collection methods in a way that you have uh, you have uh, you have a couple of them to complement each other. You have observation, you have surveys, you have focus group discussion, so that you can increase the power of your study. You can increase the fact that your study can be generalized to the target population or the entire population. Then ethical considerations, because sometimes people may feel that if they ask for consent, then like I said, the people who are being observed will now be a bit prepared and maybe they might change their behavior. So when they do not ask for that consent, then it becomes an issue in ethics. Yeah, so that was all about qualitative data uh, and quantitative data methods, whereby we saw that you can use interviews, you can use focus group discussions, you can use surveys, especially in the quantitative setting. You can also use observation, which I've just looked at. And we need now to look at how then, after you've collected that data, what else now can you do? So we look at the quantitative data analysis. And in this case, like I said, you need to do data coding, whereby you assign now the words to numbers. Okay, so if you go to the field and you collect data, for example, about the religion, Muslim, Catholic, Protestant, maybe, and any other religion. So those are just words, but the system which is going to do the data analysis understands numbers, okay? So you have to assign maybe 1 to Muslim, 2 to Protestant, 3 to Catholic, okay? So that is what we are calling data coding, and that will help you to really do the analysis easily. And you are going to better appreciate this when you do this analysis practically. So you cannot use just those words. Those words are fed into the system, and then you assign codes which the system will better understand, and it will better analyze. So then after that, of course, you do your data entry where you enter that data with the codes, and then you clean it to remove those missing values, those mistakes. Then after that, you can run your analysis, your data analysis. And the purpose of analysis is to make this data informative, okay? So you've collected all this, a lot of data, but now you need to make make meaning out of it, okay? So if I have collected a lot of data about people, about their marital status, their employment status, their religion, their tribe, I need now to see if that can maybe relate to their nutrition status. Does it mean that if a person is married, they are more likely to have a better nutrition status? So such are the things that are going to be done in data analysis, okay? How many people are married in this area? How many people are Muslims? How many people are employed? How many people are educated? To what level? So that is what we call the data analysis. Then you present now after you've analyzed. And how do you present? You can either present in text form, you can present in figures, tables, pie charts, photos, according to what you have really got, either from analysis or the data that you have collected. And this presentation, of course, is done especially to all the stakeholders. Everyone should be able to know whether the program worked or did not. And that can be done through if they are presented this data, if you present this data to them, okay? Or they should be able to know where the population stands if you do this data collection at the start, okay? So you do this by presenting to them this data. So to better understand data analysis, we are going to look into it more. And we realize that data analysis can either be descriptive or inferential. And when we talk about descriptive, we are just looking at from the word just describing, okay? You want to look at things like percentages. How many people, like I was asking, how many people are married? How many people are are educated, okay? What is the mean height of these people, okay? What is the mean weight? What is the mean age, okay? And then when you look at the measures of dispersion, how 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 uh, how uh, how is the sample varying from that mean, okay? That central point where we are looking at maybe the mean age. How are people dispersed from that age? That mean age is what we call the measures of dispersion, and we utilize tools like the range, interquartile range, variance, standard deviation, and these are also better appreciated when you're doing it practically. Then inferential statistics. So we said data analysis can either be descriptive, where you just describe your data, how many people are married, how many are educated, what percentage of women are married, what percentage of children are of this age. So those are just descriptive statistics and are part of this data analysis. But number two is inferential. Now you want to correlate the variables, okay? Like I was saying, you want now to relate one variable with another, okay? For example, those variables which I was talking about, what we call social demographic variables, like the education, the employment, the the age. Those are social demographic. Now you want to relate them maybe to nutrition status, which could be another variable in that case, okay? Which depends, which in this case will be the dependent variable, and it will be depending on these other variables. So now you want to link these two. Does does being educated make you get a better nutrition? So you run those tests that can link these two variables, okay? You want to know, does being married make you to have a better nutrition status? So those linkages are what we are talking about in inferential statistics. Again, we are going to better appreciate them when we do it practically. And the tests that you can use in inferential statistics include the t-test, the z-test, the chi-square, ANOVA. And here you're basically wanting to show how the relationship between these two variables stands. There could be a relationship, but it is not strong enough. Okay, so you do these tests to make sure that you bring out the fact that either the relationship between the two variables, for example, education and nutrition status, is strong and and should be paid attention to. Okay, then the other tests are also better appreciated when you learn that statistical software, but they're important to know. So after you've done analysis, like we said, you report. You give a report to the stakeholders so that they know what is going on, what happened. Like I was saying, you can do data collection at the beginning, throughout, and even at the end. So at the beginning, you need to show these people what is in place, or what is the nutrition status at that place, at that point. What is causing that nutrition status, okay? That is why we need that data analysis. Then at the end also, you need to show, after your program, or with your program, what has changed, okay? And these changes, can it be related to your program? Such things. So you put them in a summary of this report, and this report always has chapters. It always has components like the introduction, where you talk about uh, the background of, for example, this program, the people funding it, when it started, when it is going to end. You look at its objectives, such things. And then the executive summary, or what some people call the abstract, is really like a summary of whatever is in that report. It can show the objectives, it will show the methods that were used, some few key findings, and the conclusion. And then after you've done that executive summary, now you go deeper into whatever you've mentioned in this executive summary, which include the methods, how did you collect your data, and then findings, what did you find out, okay? The conclusions, after you have found out all that, what can you say about it, and then the recommendation, what can be done to 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 make a better change. Then of course there is always the references. So when you are doing your introduction, and even before you do methodology, you collect some data to show maybe how similar studies have been done and their findings. So wherever you conduct, wherever you read that from, you have to cite it, and it comes in this component of references. Then in appendices, you look at things like letter of approval to do that research. You look at things like the questionnaire that you used and all the other things. And the work plan, the budget should also appear in the appendices. Then, so for us to generally make sure that our study, our evaluation, our research is very valid and reliable, or it can be generalized, the findings can be generalized to the bigger population, we have to do what we call triangulation, and this requires us to use different sources, different methods of data collection, which will increase validity. It will increase the fact that our study can be, or the findings of it can be generalized on the on the on the general population which we are looking at. Okay, so if you are studying uh, if you're studying about the nutrition status of people in the south of South Sudan, your study or your outcomes or your findings should be, even if they are got from a sample that was picked, and it is not the entire population because of your resources, it should be able to depict the picture that is in what, in the entire of that south of South Sudan. Okay, so that is what we can do to make sure that that happens. Then another phenomenon that we need to know is data saturation. This normally happens when you are doing that qualitative data collection. So you can be collecting data qualitatively from these respondents, but you reach a point whereby you cannot get any new data from them. Okay, that they are repeating the same things that you had already captured. So then you have reached at that stage of data saturation, and there you can stop your study. Uh, then again, in qualitative data collection and analysis, there is a phenomenon called theme generation, whereby, yes, you have collected a lot of things, you have noted a lot of things, you have recorded a lot of things, but there are some things that there is some information which can be brought together. So if people are talking about the practices of their nutrition, they are talking about how many meals they are taking. So now you can group that under the same theme. Okay, then the others talking about the cultural norms of maybe eating, how ladies are supposed not to eat some food, and then men are supposed also not to eat some food, so that you can also bring in another theme. So that is what we call theme generation, and it is a very important aspect of qualitative data analysis, whereby uh, you group this data that you have collected in those themes. But of course, each theme should be having data that is similar. Okay, and so that you can analyze it better. Another phenomenon of research or monitoring and evaluation or data collection is what we call pilot testing. Before you go out there with your data collection methods, you need to pre-test those methods. Okay, and you do this, generally they always do it just before the actual data collection, and it is majorly to find out if these tools are going to work, if they answer the questions that you want and are related to the research objectives, and if they can really be understood by the participants. Okay, so that is why pilot testing is important. And of course, we cannot talk about research without talking about ethics. So earlier we had highlighted about privacy. Someone should give information in a place or in a way that they do not feel uncomfortable. Okay, informed consent whereby you tell them why you want them to give you information, the benefits and then the risks, and then you let them voluntarily accept to take part in your research or the data collection. Then confidentiality, you should never at any time reveal their identity to any other person. Okay, but of course all this does not take place before your research, your study is approved by a regulatory body or a research body like Ministry of Health in the health setting, or an institutional review board, especially for those study purpose researches. Okay, so each most institutions do have this institutional review board, and they are the ones which give green light to either their students or their academic staff or anyone who is going to go through that institution to do these assessments or researches. Then another term that we need to know is that appreciative inquiry, and it is basically using those good interview skills that help you to really bring out what is required to answer those research questions that your organization has set, to better understand the problem that is puzzling them, so that they can create the best solution after they have used such interview questions that have been set very well. So you, as an M&E specialist in those nutritional programs, you need to be very well conversant with how you ask your questions, how you interview people, so that you interview them or you set those questions that will be able to answer the questions that are going to let that organization or your implementing organization to really get the right information which can be used to solve the problem that is existing in that population that is being targeted. So, in conclusion, we acknowledge that there are ethical issues in evaluation or conducting research. For example, interviewing children can be problematic, especially if you cannot get someone else to consent for them. And even when they consent for them, sometimes the children might not be willing to take part in those studies. So it is always an ethical issue. Then dealing with individuals in need. Sometimes they are excluded from these studies, and yet they are supposed to be there. Persuasion through maybe use of money. If a person does not, for example, if you really want information from a key informant and they do not want, or you have sampled using systematic sampling and that person has to be interviewed and they do not want, and now you want to pursue them using money, it will be an ethical issue. Then safety of evaluators can also be ethical in a way that sometimes they can face the primitivity of the target population, whereby we've had people being lynched. Some of them end up with injuries because of not explaining themselves to these people or the target community. So all those are ethical issues in evaluation. So in the end, we acknowledge that there are very many data collection methods, but for you to choose the best, you cannot say that there is that clear cut strategy for you to choose the best. But the best way to arrive at an appropriate data collection method is to look at your objectives of the research and involve all the stakeholders from the word go, so that you can get the best data collection method. Do this data collection in a very objective way without using your bias. And then once you have got that data, code it very well and clean it, analyze it so that you can get out the information that will be essential in informing either the improvement of your program, in also informing you on which direction you're going to take, especially when you do it at the beginning, or how to improve future programs, especially if you do it at the end, and also show you whether you did well or did not do well. So thank you so much for attending this session.